Good evening, everyone. I'd like to call to order the CMH full board meeting for January 22nd, 2025. Please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next, we will have the reading of the mission statement from Donna.
Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Donna. Next item is adoption of the agenda. I'll take a motion to adopt. Motion from Donna, support from Antoinette. Comments or questions? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Agenda is adopted. Next item is hearing of the public. Anybody from the public wishing to speak to the board, you have 5 minutes. Come up and give us your name. Anybody from the public wishing to speak? All right, nobody's jumping up, so we'll close the first hearing of the public, and there is another before the end of the meeting. Move on to item 5, which is the minutes. I'll take a motion to approve the minutes of the CMH full board meeting held on Wednesday, December 18th, 2024.
Support.
Motion from Antoinette, support from Mark. Gotcha this time, Mark. Any comments, questions, or changes to the minutes? Hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Minutes are adopted. Next, we'll move on to item 6. Take a motion to approve the CMH Board Program and Budget Committee meeting minutes held on Wednesday, January 8th, 2025.
Support.
Motion from Dana, support from Lori. Comments, questions, changes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Those minutes are adopted. Next, we'll move on to item 7, which is a list of items to approve. I'll take a motion to approve items A and B.
Support.
Motion from Antoinette, support from Selena. Are there any comments or questions on these items that we discussed at Program and Budget? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to 7C. These next 3 items were new items. We did discuss them briefly at the end of the last meeting, but Tracy wanted to touch on a few of them, so I will take a motion to approve the PIHP change number 1.
So move. Support.
Motion from Selena, support from Lori. Tracy, go ahead.
Just as a quick update, this, as a reminder, is our PHP contract with the First Amendment. The items that are being amended there, outside of some very high-level administrative language, is the change to pay $66 an hour for ABA services. Just as a friendly reminder, the state of Michigan is required to get CMS approval, or Center for Medicaid and Medicare, and they are still waiting on that. Based on that, I would suggest you consider bringing this and tabling it to the next meeting in order for that CMS approval to come in. We're not suggesting not to, just we're saying that would be something that would be potentially prudent for you to consider. If it's helpful, other regions are doing the same, because remember, once you sign the contract, you will be required to pay at that level. And we just want to make sure all the T's are crossed and I's are dotted.
Okay, so we have a motion to approve tonight. Do we want to amend, does anybody want to amend that motion to table it?
I will amend the motion to table it till our next meeting.
Is that
I
support?
second it.
All right, seeing as there's a motion to table, there can be no further discussion. All in favor say aye.
Aye.
Aye. All opposed? Motion passes. The item is tabled. Next, we'll move on to item 7D. I'll take a motion to approve the CCBHC short contract.
Support.
Motion from Antoinette, support from Wayne. Tracy, go ahead.
So in front of you, I just handed out, earlier today, we finalized the agreement, the short agreement between Easter Seals Mork and ourselves. This is the agreement that would allow us to move forward with payment from October 1st through December 31st. That's why it's a short agreement, because it's just acknowledging that. In there, we're specifically bringing for, you already looked at it, right? We're just bringing it back to you because there were some edits to it. Nothing hugely different, but we just wanted to draw your attention to it and answer any questions if you had them. And of course, Drew is always here if you had specific questions.
Any questions for Tracy or Drew? Okay, hearing and seeing none, all in favor, say aye. Aye. All opposed? Motion passes. Next is item 7E. I'll take a motion to approve annual CCBHC contract. So moved. Support. Motion from Dana, support from Antoinette. Tracy?
You also saw this one previously. We're just bringing it to your attention officially. And again, this is the agreement between CNS Healthcare, Easter Seals Mork, and the Judson Center, all beginning January 1st and ending September 30th of 2025. And it's just a full array of the agreement outlining the expectations. All have been shared with those organizations. And of course, if they do have questions or anything like that, we've encouraged them to reach out, and myself and Drew will happily work with them to get this fully executed.
Thank you, Tracy. Any questions? Any comments? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Motion passes. Okay, we'll move on to item 8. Thank you, Tracy. Receive and file, no items there. Next, we'll move on to item 9, resolutions. I'll take a motion to approve the resolution for Ryan Fantuzzi.
So move.
Motion from Selena, support from Antoinette. He's obviously not here tonight, but we will get him a copy of this, obviously, and we are grateful and thankful for all of his time that he put forth to this board. We're going to miss him, and I hope he's doing well in wherever he is now. Any other comments or questions? I promise we'll get it to him. Right, Tracy?
Yes,
Yeah.
we're going. Sandy.
All right. All right, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? The resolution is adopted. Thank you. Next, we'll move on to item 10. I'll take a motion to pay the bills.
So move.
Support.
Motion from Selena, support from Lori. Comments, questions on the bills? Hearing and seeing none. All in favor say aye.
Aye.
Aye. All opposed? Bills are paid. And we'll go to the CFO update. Ken, Tony, Ken. One of you, another of you.
What's that?
You should be set, Tony.
There we go, okay. Good evening. We're going to present November financials today, and I'll do an overview of the financials that are in the packet, and then Ken will speak to some of the headwinds and some of those other things that we know that are going to be part of our fiscal year 25 challenges. So with that, I would say I was trying to find the right word this evening, maybe prudence, caution. We're going to see some favorable numbers here, but as we're going to hear, we do have some challenges, some unknowns. So I just put that out there as we go through our November reporting. A few of those things as we think about the uncertainty with the new CCBHCs, the fact that we know that the general fund and some increased spending there, the ISF issue remains open, and there's other regulatory things. And again, Ken will talk to some of those as we go further along. So let's go to page 2. Just looking at the first chart, looking at the one that's labeled revenue. The only thing I wanted to point out there, if you were to look at the fiscal year 24, which is represented by the red line, you're going to see a little spike right at the end in September. And we did receive about $2.6 million of retro payment from the state. That came in October, but it is for fiscal year 24. That's why you're seeing that slight increase at the end of the year. Everything else is trending according to plan on that graph. On the eligibles, as we would expect, it's stabilized. We're not expecting any additional dips in that. So right now, I guess we would just characterize that as stable in terms of our eligibles.
So I'll just highlight too on that revenue chart. One of the things that Richard's coordinating with the other PIHP is trying to, they gave us a bump for 24. But what does 25 look like? So that data is all being gathered up statewide to see what that trended projection is for everyone. The state, I think, statewide put in $60 million. but felt that that was quite a bit short for 24 and what that looks like going into 25. So definitely keep the board updated with anything that comes out of that, but it's one of the ongoing projects.
Okay. Any questions on that first graph? Okay, next page, looking at the comparative charts with our assets, liabilities, just a couple things I want to point out there. Just looking at the cash and investments, just because it's top of mind. We were over at the county building today. We have good communication with Christina in the treasurer's office. So just to remind this board that these assets are invested through treasury. We work obviously very collaboratively with the treasurer office, and they support us really well in ensuring that our investments are properly invested. So I just put a plug in for Christina and her team. On the liabilities, just pointing out in that middle graph where you see the due to, the liability, just remembering that the big dip from the 136 million you see in prior year to the 61 million was the fact that we paid that liability to the state, the $62 million. That's why you see that big decrease. I don't have any other highlights on this page unless there are any questions. Next page, the only thing I wanted to point out is if you look at the third graph on the net income, for whatever reason, our September dropped off. So I'm just going to acknowledge that right now that we need to do another review before we publish these. So you're not going to see the September in that graph. But again, nothing out of the ordinary on here, but we did want to move to page number 5 in your packet and talk a little bit about the financials there. So I'm going to focus on the 2025 actual column, point out a couple numbers. So the first thing you see under Medicaid, there's a surplus of about 7.3 million, and under Healthy Michigan, a surplus of about 628,000. But I want to point your attention to the expense line. So we're currently trending below our budget. So we're seeing favorable expense. Looking at some of it, what's contributing to it, at the moment, there's payroll and vacancies. So if you recall, we budget for full staffing, so the budget's going to have that. We're not incurring those expenses. So that probably accounts for about a good portion of that variance. Couple other things, there are some mandated expenses that we incur throughout the year, the HRA, the IPA investment. We budget those flat or spread those across 12 months, but those only come in periodically. We can revisit that in terms of budgeting, but that is part of the favorable that you're seeing there. That would be about another 2 million. We looked at a high level, our provider claim experience. So we're running about $900,000 currently favorable in what we budgeted to what we're seeing in terms of expenses, but that could be due to claims lag, any number of things. So we'll watch this, but at the moment it's favorable, but we know that there's a lot of cost built into our provider network. And the fourth piece is just our third-party direct contractors. There too, we have some vacancy and we're seeing a favorable. So we'll watch. This is very favorable going into November, but there are some costs that we're going to incur as the year goes on. Any questions on that? Hopefully that was helpful.
I'll add a highlight
Okay.
to this as well. I haven't sat down and fully conceptualized what this page is going to look like with 3 new CCBHCs on it. Through December, we'll obviously just have the one, but it's likely that we're missing expense out of this bucket if some of it is currently with the providers that are coming on board. This redirect to CCBHC, whatever portion of base cap, just as a reminder that everyone's PPS1 rate in the state has a base cap component, like our traditional funding, and then there's a supplemental piece that's not part of that, but we don't know yet what that impact is going to be, particularly with Easter seals up through 12/31. So these numbers are, Tony said exercise caution, where I'm expecting them to change fairly significantly from one period to the other. So this is the best information we have right now based on what we have, but there isn't a way to project or predict exactly what that's going to look like. The mild to moderate versus severe split, depending on what that looks like, will skew this. So there's a lot of factors that go into here, but I just wanted to highlight that for the board that as this picture looks good right now, and it very well could continue to look good, but maybe not as good based on new data that rolls in. So once we have those things sorted out, we're working on the system enhancements and things for that. We can update this report. But I expect the presentation to change in a lot of ways too, to try to parse out, separate, and present something meaningful for how those new CCBHCs are impacting. So.
Okay. The last number I was going to highlight on that page is just the risk reserve. So we've updated the 58.9 to reflect the most current report from the actuary. So that's been updated. On page 6, just a couple things there. If you look at the very top again under the 2025 actual, there the CCBHC, the specific GF allocation. We have commented before that the 351,000 that comes our way is inadequate. What you're going to see in the 25 columns, we currently don't have that. We usually don't get that allocation till about June. So you'll probably see this as a zero or a blank until we get notice of those funds. And I would expect that they're probably still going to be inadequate even when we do get those.
And quite a bit less as the pie gets spread to more CCBHCs.
Yeah. Let's see, the last thing I was going to point out, and then I'll hand it over to Ken, is if you go to the very bottom, we have about $3.5 million surplus. You know, again, here, some of it is the interest payments, but we expect those to go down now that our investments are going down because some of the expenditures and payments we have to make. Unspent PA2 dollars, the local allocation that we get from the county, unspent. So there are a few things in there. We're going to watch that a little bit closely too, and we think it's a bit high right now, so we're going to watch some of those items, and we expect that surplus won't be as high as we go forward again, but just the overall theme of prudence or caution, whatever word we want to use.
Right. You know, for example, like the state inpatient claims are on a known lag, so we have those, and that's largely what's the county funding goes towards, so to speak. So just a big piece of expense that we have that isn't quite recognized. So I usually have a few things that I just want to highlight that are not necessarily in the financials, but things that we're looking at or doing. Right now, we're in the height of reporting season, which is finance's time to shine, right? So we're all looking forward to that February 28th deadline. We have financial status report, encounter quality initiative, medical loss ratio, CCBHC cost report, the
Specific fund account.
Yes, and the state, I think last week, tacked on an additional cost report for our CCBHC that's new this year. So Tony and I are doing that. But it's a huge team effort in finance and all the things we're doing throughout the year. So as those results become available, I'd be surprised if we had anything final for February's board meeting, but certainly in March, I think we aim to bring what that looks like, our new PPS one rate, all some of that good stuff to the group. One of the other things that I think a lot of people are monitoring closely is to see what happens with the Earned Sick Time Act and anything that's going to impact minimum wage. Earned Sick Time Act, I think one of the things that's very specific that could impact folks is how that would impact self-directed arrangements. As the person served is the employer there, and this would technically apply to them as they have one or more employees. So that feedback's been sent to the state, and I don't know, with everything going on, what that's going to look like. The minimum wage piece, the concern there being that I'm going to say, erases, for lack of a better term, some of the DCW gains that have been made over the years. So what's the plan with that? As minimum wage goes up, it kind of implies that costs are driving up. What is the funding impact for that? And I don't know that, we haven't had those answers either, but it's a couple of the hot topics that are going on, I'll say statewide in a lot of ways. We continue to track and follow and participate in the Plan First discussion. I think Alan alluded to it. I think it was a program and budget a couple weeks ago was the one he was at, but huge issue statewide. Been talking about it for a while. I think it's finally being quantified, and specific efforts are being targeted to that. I have not heard what's going to happen with that. We're trying to assess what our options are for reporting for these folks that appear to be in the wrong eligibility class. And we're soaking up GF dollars with that. That's a real cost to us. And with CCBHC and some other things going on, those are precious dollars. So we'll see what happens there. And the last thing I had, I think I already spoke to, where we, looking at our CCBHC funding as a whole and how that's all gonna impact over the next 9 months, I think it's gonna be our biggest challenge and lift as we go into the next year. So, those are all the things I had. Any questions on those items or other questions?
Thanks, Ken and Tony. Are there any questions? I just want to add a quick editorial in on the earned sick time,
Sure.
minimum wage stuff, because the House created a special committee just to address those issues. There were 2 bills that were introduced. They passed, I believe, unanimously out of committee. Both of them did. And I think they're supposed to get voted on in the House tomorrow. And I think the Senate is doing their own versions, but I don't know the status on that side of things. I just know the House side, and it's just going to be a matter of the House throwing it at the Senate, Senate throwing it at the House, and where they meet in the middle to decide or not to decide to change anything. So the House is moving. I don't know where the Senate's at, but that's the latest that I know, for better or worse. We'll see what happens.
Yeah, I think everybody's waiting to see what happens. And I've heard anecdotally that some companies even and other entities have already implemented it. So now they're trying to figure out, okay, well, if it changes, do we roll this back? So I think wait and see is probably the best bet right now.
And
But
then there's some that didn't even know about the change. So you really have both sides of the coin
also
there.
probable.
Yes, so that's my update from the House. Any other comments or questions for Tony or Ken? Okay, thank you both.
Thanks.
I appreciate the update. Next, we'll move on to Tracy with the CEO update.
Just to add some additional information directly related to our organization and the SIC Act that you guys were just referencing. The county has one part-time person that would be applicable for, let me clarify, Macomb County Community Mental Health has one, and we do have some contract staff members that would have to be addressed. We're, of course, already have the plan in place to address it, but it would not be a monumental impact. It would have financial impact to it, but, and then to Ken's point, our biggest concern, that is something it's glitchy, but we can work through it. The biggest concern is how this affects self-determination and what that looks like. And then, of course, we do have a meeting with the Provider Alliance, which we greatly welcome that opportunity to try to figure out the minimum wage is going up. Then you have this, every employer has larger expenses, which means that provider has larger expenses, which means we have to make sure that there's funding available to do that. So if you notice throughout the last couple months, we keep on kind of pointing that out because there's a lot of unpredictables, a ton of them. Then a lot of them are swinging in this large dollar amounts. So just kind of really pay attention to everything Ken and Tony is saying, because we do predict in the next couple of months to start to see some of those caution items that we have talked about coming to fruition, right? And it should dramatically swing our financial situation. Related to that, yesterday I did send the board report. If you already haven't looked at it, please do, because that will provide you a little bit more insight that maybe we don't have as much time for me to go in detail with. So I would encourage you to do that if you have not. In that, though, also want to just highlight, you can watch them if you already haven't. We are excited to share the draft AOT. AOT, again, is the through the probate court, forgive me for not articulating it correctly, opportunity for someone to get some additional assistance. I'm minimalizing it. It's a very complex thing that a lot of people can get very confused with, so you will see those videos, and again, there's 6 of them targeting specific audiences. The most exciting part about that is earlier today I met with the state, also I will remember their department is different than MDHHS, specifically on this was shared with numerous organizations within the state of Michigan, and they like the video so much that they're asking us to go back and see if we can work with the production company for them to be used statewide. So right now it says Macomb County Community Mental Health. So they're asking us, can you, if we give you more funding, can we create a statewide message at the beginning, a statewide message at the end? Also expanding, I thought this was a great suggestion. One law enforcement said, hey, can there be another video that talks about if I'm a law enforcement officer, because it does explain AOT from a law enforcement perspective. But what if I actually want to pursue an AOT for a person? How do I go about doing that? So the state has asked us to further pursue that, and again, give us the funding to further pursue that. And they have, I thought this was very flattering, not to myself, but our team, that they have 0 edits, and there was not a single negative, and they kept on focusing on that. They said it's well done, and they would want that message shared across the board. So I just want to make sure if you see our communications team, because they put a ton of time and a ton of energy into it, to congratulate them for their efforts. I mentioned I walked around, I showed this to a lot of you, but because Phil is amazing, he is hand delivering 21. Yes, we all deserve a high five, a something for him. Yeah, I do have a dolly in my car. I'm supplying the dolly and the boxes. So we are excited to share, and I've shared this with many, but we developed a legislative package. It's the box, and anybody who's here is welcome to look at it if you already haven't. In the box, it has a letter. It has one-pagers on all the main services we provide. But the concept would be, we want our legislators to be educated about the services that we have available. They do get contacted to say, hey, I need help, right? Where do I go? So we've given them an actual box with a holder of our help, of our pocket guides, right? So if they have someone come to them, they can literally just give it to them. We, of course, also took the opportunity to educate them about not just our services, but potentially about what are the mental health concerns of your constituents, what are the substance use concerns. So in the box, you will see Narcan. You'll also see an explanation to what is naloxone. You'll also see a fidget spinner, and then it ties it back to autism. So it just kind of is trying to educate them on a very plain level, right? Sometimes when you have tangible things, people can better understand what we do. So this is our product, and we're trying to help them understand how we can help them, and ultimately how they can help our community. So we're excited about that. I greatly appreciate Phil hand delivering them in the sub-zero weather.
It's gonna warm up.
Yes. It's like 10, right?
Yeah.
So what we'll also do is we'll follow up in about 2 weeks or so electronically and send them an electronic copy. But all of this has QR codes and sites and clicks and everything so that they can utilize as a follow-up item. So thank you again, Bill. Just one more slight, I have talked to a couple different groups about this, but we are considering doing a town hall meeting. I know we've got some good feedback, like the CAC and a couple other groups. The town hall meeting, we're thinking, and nothing's been absolute, but I'm just throwing it out there because if you do have some feedback, we welcome your thoughts. If we do this, we want to do it well. It would be most likely in the spring or summer. It would have a segment that would talk about a subject that matters to our community. So one of the ideas we're thinking about is the crisis continuum. So in the spring or summer, the SUD center, right? I think I saw Nicole, right? Will be open and running. Because Nicole is going to make sure that's right going to happen. At that point, also, we will be further along in mobile crisis. We'll be further along in kind of just expanding our relationships. And there will be, at that point, there should be probably over 100 officers that we have been part of the training for the CIT program. So we think it'd be a great opportunity to educate our community on what Macomb, and just to be clear, not just Macomb County Community Mental Health, what Macomb is doing in order to address this challenge that our community is facing. But then it would be an open discussion. I think a great idea was suggested where we would offer people to submit questions ahead of time. Not that they can't ask questions on the spot, but that would allow us to better see, like, what are the questions people want to hear about, so we can make sure the person that would be able to best answer that question would be there, and of course have tables and additional resources to find out information. So I would just offer to you, if you have any specific ideas, thoughts of any sort, both positive or negative, please share them with you. So we don't want to formalize this until we get some good feedback, ironically, about how we should get feedback. And that is all I have, unless anybody has any specific items they have questions about.
I don't see any. I just want to mention real quick and highlight Tracy for being in the Macomb Daily recently. You want to touch on that real
I
briefly?
sent it, it's in a link if you didn't check it
Yes,
out.
you did send it, but-
I was very excited that, that's not a true statement. I was not excited to be interviewed because I'm not a big fan of that. What I meant by that is we're excited to share the cool stuff we're doing. If you haven't read the article, it was really focusing on the point count. If you're not familiar with that, that should have happened last night, which is ironic. It's from 7 to 10 p.m. They count how many homeless people are in Macomb, and then they use that to obtain funding. And you guys know how cold it was. So guess what? There probably weren't that many people because their definition of homeless, like if you're couch surfing, that doesn't count. If you're in a shelter, that doesn't count. So I know that they're advocating to move that to the summer because that would make so much more sense, right? Especially it affects Macomb County's funding. But anyway, the article, I was interviewed because our homeless person wasn't available because I trust her much more. But I was interviewed in the way that we got a great opportunity to talk about what we're doing to address homelessness specifically in Macomb County and how our organization is playing a role in that and basically partnering with law enforcement. So if you haven't read it, I would encourage you to read it. It's a topic, we've talked about transportation, but we've also talked about housing insecurity. So it is an area that we want to continue to not just be aware of, but make sure we're part of the solution.
It was very informative. Thank you for doing that. All right. Any other comments or questions for Tracy? Okay, seeing none, we'll move on to item 12, other possible agenda items. One reminder, we do have program and budget here on the 12th of February at 6 p.m. And are there any other board members that would like to add anything? Lori, go ahead.
Yeah, I just like, because I know you've all received a couple emails already regarding the PAC. So I will send out reminders again with the link that you can do that for us or send a check-in for their address. So I just want to remind, I've gotten a good response so far. And Dale, this isn't just for you.
It's for me too, Dan.
I'm watching them, because I'm sure you guys get tired of seeing emails from me asking for the same thing, which is usually money, so.
Thank you, Lori. Thank you for staying on us. All right, anybody else? Okay, seeing none, we'll move on to provider comments. Are there any providers that wish to address the board? Any providers? Okay, seeing and hearing none, we'll move on to the hearing of the public. Anybody from the public wishing to speak? Anybody from the public? Okay, hearing and seeing none, we'll close the hearing of the public and I'll take a motion to adjourn.
I move we adjourn.
Motion from Dana, support from Wayne. All in favor, say aye. 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 We are adjourned. Thanks, everybody. Have a good night. Stay warm.